Hi you guys, I hope you're all doing well and keeping safe. I am so excited to finally speak about oral health. So I constantly speak about gut health. I believe it is one of the most important pieces of the puzzle when we look into the health of a human body, and nothing in the body is disconnected. Everything is connected in this body, in this universe. You and I, we are all connected, and it's very important that we understand the huge and important role the mouth and tongue and teeth plays. And once we understand how beautifully the body is doing minutest of the things without us being aware, it just changes the way you look at your body, and it just changes the way you eat, which then changes your body and your life and everything henceforth. So I quickly wish to speak about oral health, and in my next video I will speak about a few practices and a few products that you can use and just take care of your oral health. So number one, when a child is born, so basically when the child is sucking on the mother's nipple and he is just taking in the milk, that is where your oral microbiome begins. Okay, so when the mother is pregnant, or when she starts to lactate post pregnancy, she is going to, so her gut bacteria is going to travel from her lymphatic system to her breast, and then the breast milk is transferred to the baby, where the oral microbiome is now going to develop. In the initial months, the oral microbiome and gut microbiome are not differentiated or separate from each other, but after a few months and as the baby starts to grow and is being exposed to a lot of things, the microbiome is going to shift and differentiate from each other. So your oral microbiome and your gut microbiome, so the bacteria, the trillions of beautiful bacteria that lives inside the large intestine, it becomes differentiated from each other, but they are still connected. So it's like, they are like siblings of each other, and it's very, very important that a child is breastfed. Okay, when you look at when a child is born, so you look at C-section and you look at normal delivery, so it is always noted that people or the children who are born via normal delivery have a better health overall, because they have been exposed to the microbiome, vaginal microbiome of the mother, and that just gives the baby the health that it needs to just get through life and live in a toxic environment like this. Okay, now why is breathing so important, and why is oral health so important, and why breathing correctly is so important? Like, you are always breathing, okay, it's just automatically happening, it's your autonomic nervous system, but the way you breathe is also very, very, very important. So crooked teeth and tooth decay, having erosions, having cavities, having bleeding gums, having thick white coating on your tongue, having bad foul smell from the mouth, and all of these things, it's just not normal. Because just because you can go out and get your tooth extracted, it does not mean that you do not pay attention to your mouth and why is it reacting in such a way. So just in a way, the gut microbiome has trillions of bacteria, your mouth also has the same thing, and it is very, very beautifully studied, and that is how we know so much about it. So when you just look at breathing, okay, we can quickly do this together. If you're just watching my video and if you're not doing anything, just observe where your tongue is. So is it towards the lower jaw, or is it touching your roof? So ideally, we want the tongue to touch the roof of the mouth. So tongue is never resting on the lower jaw or the lower bottom part of the face. It is usually resting towards the upper palate, and that is how your mouth is going to be shut, and now you're going to breathe through your nose. Okay, so there are mouth breathers and there are nose breathers. We are designed to breathe through the nose and not through the mouth. So people who wake up with dry mouth and people who have issues with their energy and they feel lethargic and tired, it also has a lot to do with the way they are breathing, because as we all know, oxygen is prana, it is energy, but at the same time, when your tongue is touching the upper palate and it is just putting that kind of pressure, it actually releases something known as nitric oxide, which works as a vasodilator, and that just gives your body the correct amount of blood, oxygen and nutrients it needs to survive and get through the day. So every time we are breathing, we consciously always want to breathe through the nose and not through the mouth. So if I'm like this, okay, my tongue is now going to touch the roof of my mouth, and then see how I'm going to breathe. So a lot of people at the same time are going to breathe like their mouth is always open. And you always have to remember, if you're breathing through your mouth throughout the day, there is huge possibility, and I think it's just very, very possible that you are breathing with your mouth open through the night, which creates a lot of pressure for your brain, for your system, for your nervous system. So when I am breathing through my tongue, I am actually sending signals to my autonomic nervous system to be in a parasympathetic mode, which is rest and digest mode. So my body is in a very rested and calm mode. So it's like when you are taking up the stairs and you suddenly don't have energy, you will constantly open your mouth to breathe. When you're just running and or you're on a flight of stairs and you're just constantly going upwards, you would be out of breath. And when you are out of breath, or say when you're in the gym or when you're doing some kind of cardio or HIIT workouts, you will constantly open your mouth and start to breathe, right? So your body is just trying to get in the enough oxygen, because you need oxygen for every single process in the body. Your every cell is going to need oxygen to do the metabolization, assimilation, absorption, detoxification. So when you are not breathing correctly, you don't give enough oxygen to your body, and this can also interfere with your sleep. So there is something known as sleep apnea, there is something known as upper airway resistance, and all of these things are some way or the other connected to the way the person is breathing. So if possible, the one thing that you have to take away from all of these science and nerdy things that I'm throwing at you, it's that you have to constantly make an effort to breathe through your nose and not breathe through your mouth. So as much as possible, that is where your meditation and deep breathing and pranayama comes in, because it forces your body to be in a rest and digest mode. And when your body is in that kind of homeostasis where your blood pressure is balanced, your blood sugar is balanced, your overall health is just going to feel great, right? So you always want to breathe that way, and at the same time you want to focus on the kind of foods that you are eating. So there is something known as pH, okay? We always want that acid and alkaline balance in the body. Your stomach should not be alkaline, your blood should not be very acidic. So different things in the body has different pH, and when we look in the mouth, the oral cavity would be around 5.6, 5.7 to around 6.7, 6.8, so somewhere between the range of 5 to 7. So it's not very neutral, it's not very acidic, it's not very basic. So we want to be somewhere around here. Now what happens is, we have microbes that lives inside of us. We have microbes that lives, we also have something known as osteoimmune system. So your every teeth has an immune system of its own, and these osteoimmune system can spit out cells. These cells are known as odontoblast, and the odontoblast cell is actually in the presence of your vitamin A, vitamin D, vitamin K is going to be activated. It's going to produce some enzymes, and that is going to help with the health of your teeth, which then in turn helps with the health of your metabolic syndrome issues, health of your blood sugar, health of your cardiovascular diseases. So I think one of the finest markers when we look into CVD is doing your calcium coronary score test. So this is how it works, because you need, whenever you are focusing on calcium, you need vitamin D, you need vitamin K to put it in the right places, and all of these vitamins are also needed by your teeth. So it's very important to look into the kind of food that you are eating. So people who have biofilms or dental plaques, or they have crooked teeth, or people who don't have a very wide palate, and usually the palate is like a V-shaped and not very U-shaped, this is like a modern world, okay? These were not the issues of the past. Even when people did not had brush or tongue scraper or flossing, even then people had much better teeth than we do. They did not used to have a lot of bleeding gums and stuff, but people in most modern world, Western world, have this because of the kind of diet that we follow. So people who are constantly eating white sugar and refined sugar and simple carbs and simple sugar, all of these things affects your oral microbiome. How? So when you are eating something that has sugar, it is going to make the bad bacteria in your mouth. So again, we always have the balance between good and bad. We don't want just good, and we just don't want bad. So the balance, the bad bacteria is going to eat that sugar, and it is going to produce a very acidic environment, okay? So the pH of the saliva goes way too down than it is needed. So way below 7, way below 5 and 6, and in this kind of environment, when there is less oxygen, bad bacteria can thrive, it can overgrow, and that creates a problem. So people who have bad smell, mouth smell, tooth decay, cavities, and all of these things, it has not only everything to do with bacteria and infection, it also has a lot to do with the kind of food that you eat. So that is the reason brushing your teeth in the night is so important, and you are making sure that you're not sleeping with food stuck in your teeth. If you have gaps or spaces between your teeth, you want to sit with a good dentist and just look into this and make sure that you can take care of it in the best way possible. People who have sleep apnea, people who wake up feeling tired and lethargic, they wake up with dry mouth and they feel like they just don't have energy in the body to do anything. It also can be trailed back to the way where they are not sleeping correctly at night. So when their mouth is open, the body is in a fight and flight mode, because if you just understand from the example that I gave a few minutes ago, I just said when you are trying to walk up the stairs and it's too much for you, you do not have enough energy, or let's say you're anemic and you're not getting enough oxygen to the tissues, your body is going to open the mouth to get in more energy, to get in more oxygen. So if your body is doing the same fight and flight mode when you are sleeping, you're not going to wake up feeling well. So there are a lot of techniques that people do to get out of it. There is a lot of practices and doctors and people who teach people how to breathe correctly and stuff. But I think the most two important things that I want you to look into is top three would be: number one, your oral health is very, 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 very important, and it's not just about having the teeth that looks great. It's also very important that you have that great freshness in your mouth and you do not have foul smell, you don't have bleeding gums. And if you do, you need to sit with a good dentist or maybe a functional practitioner and just discuss these things with him, because it has everything to do with the food that you eat. Which brings me to my second point, that you always want to be very careful about the kind of food that you are eating. And number three would be, you want to be a nose breather, you want to be in the parasympathetic nervous system kind of a state and not very much into the fight and flight state. So just constantly, consciously bringing your attention to your mouth, to your nose, and seeing how you breathe really, really helps you just calm down. So when I was studying about this and when I was learning this, I would just, be writing and studying, and let's say I'm in the middle of something, but I would constantly bring my attention back to my breathing, and I would just see how beautifully my tongue is resting towards my upper jaw, and it's just resting on the roof. That creates a pressure, and it is actually at the base of my skull, and it is connected to our cranial nerves. So the kind of signal my tongue is giving to the brain via mandible and maxilla, that also plays a very, 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 very important role. And we cannot just say, oh, it's just mouth and it's just teeth and it does not mean anything. Aesthetically looking good is one thing, but having that internal health is very, very important. And in my next video, I am going to talk about a few practices like oil pulling, and does it work, does it not work, the kind of toothpaste you should be using, the truth about fluoride, amalgam, mercury, and root canal treatments and stuff. So I will be simplifying it as much as possible, and I will be speaking about it as well. But you want to take care of your nutrition as always, and take care of yourself. I will see you soon. Bye.